4 years old.
I was diagnosed with Alport at age 55.
Age 28.
My daughter was diagnosed with Alport syndrome at 9 years old.
Originally, I was diagnosed with, at age 2, with glomerulonephritis.
I was diagnosed with the thin basement membrane disease, and that was as a child. I believe I had just something as simple as a urinary tract infection that led to a doctor visit and some urinalysis. And next thing I know, I was at Children's Hospital in Washington, D.C., and they did a kidney biopsy. And I have a vague memory. For some reason, I feel like they thought I had leukemia at first. And I remember being on the cancer ward at the hospital, so maybe that is a correct memory. And then finally I ended up with being told that I had the thin basement membrane disease, and pretty much have lived my entire life not worrying about it. I would get physicals at work and they would say, we're going to need to do your urinalysis over again. We're seeing blood. You must have been on your period. And I would say, no, that's just an abnormality that I have. It's fine. And not until my son started to show some problems did I even really give it much thought. I've never taken any medication, never had high blood pressure, any of those type of things. I had twin boys that both weighed 6 pounds and didn't have high blood pressure when I was pregnant even. I have 3 sons and a daughter, and all 3 sons have vision issues. My youngest son with his cataracts was able to, they did the genetic testing for him first, and then we were all tested. The nephrologist had mentioned Alports and never really officially said that's what we had. And I don't know, maybe everyone was healthy. And so I wasn't doing a lot of research and I didn't really read about Alports until at one point I was kind of like, why, maybe we need to know for sure that this is what we have. And even then the nephrologist said that she was pretty sure that's what we had. But yes, the ophthalmologist started the genetic testing for us. It was genetic testing that helped us finally confirm that we have Alport syndrome in all of my children and myself.
The first time I was aware of my hematuria was in late childhood. I believe it was first found on a sports physical or something like that. We had a family history of Alport syndrome, and my parents wanted to know which of their 2 children could possibly have it. I do remember a specific conversation that, maybe it's just, some other mild form, or maybe there's some other cause for her hematuria that's not related to it. When we first started discussing the possibility that I had Alport syndrome, we were told that there really wasn't going to be a disease progression for me, and that if I did have disease progression, it would be much later in life. It was something that we didn't need to worry about. I didn't need to follow with anyone, and there definitely was no treatment. This was the late 90s or mid 90s. I can't quite remember, but certainly did not think that it was going to affect me personally, physically. And then also, we didn't discuss the implications it would have on, my life, even if I was just a carrier, which we know is not the truth, and that I do have Alport syndrome, but the possibility of passing that to my children too, it wasn't discussed, and certainly has been a very big part of my life as I have grown into adulthood. While I received this speculative diagnosis of Alport syndrome, we were told that there was no medication that could help. At least couldn't help hematuria. The talk of having protein in my urine later in life really didn't come up. And even then, I don't remember there ever being any conversation or, hope of having medication that could help reduce that. We were told that if it was going to happen and I was going to have Alport syndrome, and if it ever did progress, well into late adulthood that it was just going to happen and there was nothing we could do about it. Because of my longstanding belief that, it didn't really matter, that there was nothing that could be done for me, I never pursued it. So I was pregnant, and during one of my pregnancies, I had some protein spilling in my urine. I spoke briefly with the doctor about that, and she told me that, this is typically concerning, but I see that you have blood in your urine. You've told us that you've always had that, can you tell us if you know that these two are related? And I said, well, I'm not really sure, but I was told that, if it ever did happen that I'd have protein in my urine, that there still was nothing they could do about my disease progression and that there was nothing that could be done. And she, by and large, took my word for that.
When she was 6, she started having some more complications. And then he wanted to test out prednisone. And when she had the biopsy, he said that it wasn't glomerulitis. Now he was like, based on what he saw, he thought it was a rare kidney disease called IgM nephropathy. And he was like, not IgA, because I think that's the more common one, but IgM. I just didn't feel comfortable because he just said like there wasn't a lot of research out there as far as treatment is concerned for a particular diagnosis. And we felt uncomfortable. Again, I started on Dr. Google, which is probably not right, but when I typed in kidney issues and hearing loss, that's when I seen Alport. When we went to the ENT, I asked him, I said, I was doing some research. She has this kidney issue. Now she's having some hearing issues. Do you think it could be Alport? And he told me, he said, well, at this time, I cannot give her a diagnosis. That is something that you would have to consult a geneticist about. And I said, okay. And he referred me to our genetic doctor or a genetic counselor.
What's interesting is that in my family, it really wasn't discussed a lot because I think my parents tried to make me feel normal. Going to the nephrologist every 6 months was very routine for me, and it was not out of the ordinary at all. But as I kind of developed in my teen years, it was really a nuisance for me having to go there and not really understanding why I was going there. Why am I doing the 24-hour urines? Why am I getting the blood work done? Why am I taking this medication that I've been taking all my life? Because it was so routine, I almost started to rebel against it. So I would often forget to take my medication, and it wasn't purposely that I didn't want to take it, but it was the kind of thing like, oh, I got sidetracked. I was busy and I forgot to take my medication this morning or last night or whatever. And I didn't really care because to me, I didn't know enough about it. I didn't know the importance or the significance. And when I would go to the nephrologist, that really showed up in my lab work. My creatinine was increasing. My blood pressure was a little bit higher than it normally is because I wasn't taking that ACE inhibitor, that blood pressure medication.
I guess the hardest part of it was actually finding out that my daughter had Alports, as she's had 0 symptoms. Her eyes are perfect, her ears are perfect. And I was surprised that she had Alports. And I guess I was even maybe a little surprised that I had it. I don't know why, but I was thinking that I wasn't going to have it. But it is good to know. And I'm so glad that we know now and we know what we're dealing with and we'll face what comes our way.
We went through genetic testing and I got my genetic testing done first, came back with X-linked Alport syndrome, which is something that we had considered. We believed that to be the causative mutation. or a form of Alport syndrome. And so through my genetic testing, we tested all 3 of my kids, and my oldest 2 came back positive also for X-linked Alport syndrome. I will never forget the phone call that I received from the genetic counselor at the geneticist's office, giving me my positive diagnosis. As I said, I was largely in denial, or at least hopeful denial that I didn't have it. And then I was told that it was positive. And I think that was when everything kind of came crashing down, the reality of the situation and the reality of the risk that my children could possibly have had it, or could have inherited it. And at that point I had 3 kids. So I knew that each of them had a 50-50 chance. And I had a suspicion as to which kids were positive. Not really sure how I did, ended up being right. But I just remember being so worried that my last baby also was going to be positive, and here I would have 3 children positive, all at the same time, and myself. So it was a lot of worry and fear and unbelievable consuming guilt, guilt that I had not really taken ownership of this speculative diagnosis and studied it and researched it and poured so much time into it that I have now. It was still something I think that I deal with now, just guilt for not having really found out. And I feel like I should have, but I know now that, it is what it is. And I made decisions based on where I was at in my life at that time. And really the only thing that we can do is just move forward.
I honestly was still skeptical, because we had been through 2 other diagnoses, I wasn't sure if this was the right one. To me, everything fit, like her symptoms fit, but sometimes, I still, in the back of my mind, is there going to be something else?
I went into this acute kidney failure episode when I was 18. And then over the course of the next 2 years, essentially, my kidneys were just, they kind of recovered a bit after that acute renal failure incident, but they never recovered completely. And then over the next 2 years, it was just kind of like a steady decline. And then when I was 20, in March of 2019, I was officially in renal failure. Both of my parents wanted to be tested to see if they could be possible donors, but we didn't know if they could be donors until we got the genetic testing done to see if either of them had the mutation. So all 3 of us, my mom, my dad, and myself, got the genetic testing done, and they confirmed that I had Alport syndrome through mine. And then they confirmed that actually both of my parents had a mutation that contributed to my Alport syndrome.
For the boys, it was fairly easy because they have been told by a nephrologist that they were fairly certain that this is what we were dealing with. So I don't think that they were surprised to hear that they had it. I think it was actually hardest for my daughter because we had even talked about she was, looking into making sure she kept her kidneys healthy because she was planning on donating. And that's, maybe going to be something she can't do now. So it was very hard for her. And it was hard for us. We found out during the pandemic, and of course kids are dealing with so much right now, and we thought, do we really want to lay this on them now that this is definitely what you have? You're probably going to need a transplant someday. So it was a hard discussion to have. My 16-year-old came to me, gosh, it was probably a couple of weeks after we had told him, and he said, did you tell me that I'm probably going to need a kidney? And I thought, oh boy, they are making this tough. But I'm glad that they don't lay awake at night worrying about it. But I wish they'd worry about it enough to maybe make some changes in the food that they eat. I have twin boys and they're 18 years old and they don't talk a lot about anything that they're thinking. And I thought maybe they're back in their rooms discussing this and freaking out, but they certainly didn't freak out in front of me. They just took it in and said, okay.
I had also tried to cope with that in the 2 months between when I received my diagnosis and when my children received their diagnosis, because this was a months long process. So I felt like I was at a good place in acceptance and just trying to make myself not live in this shadowy hole of guilt. But whenever I get that second phone call, that was the worst one. She asked me if I had a hunch as to which kids were positive, and I told her. And she said, it's so weird. She said, because when I have these phone calls with families with genetic conditions, she said, man, the moms are almost always right. And it was the case. My 2 oldest were positive and my youngest was negative. That's really, really difficult for me. I had waited for that phone call for months. And when it finally came, I was by myself. Pretty sure my voice was shaking more than it is right now talking about it. And I just very bluntly accepted the results and hung up the phone. And I sat there and I cried for hours. And then I cried for days and then weeks and then months. And there are still days whenever there is a change in their status or in addition of a medication or dealing with insurance companies that I find myself just grieving of, what it could have been if they didn't have it, but also so incredibly hopeful. And now, I have this whole area of my life that I can really devote to helping other people with Alport syndrome too. And I mean, of course, I wish my kids didn't have to deal with it and didn't have Alport syndrome, but I'm also thankful for the community that's around us, and we're not alone.
One of the things that were going through my mind, especially after the conference, learning about, number one, I didn't know that there were different types of Alport syndrome. And then when knowing what type she had, which is autosomal recessive, is that it could affect our other kids. So we then had to go through the whole testing of everyone. And that was kind of scary because it's like, again, I have 5 children total. That was crazy. Like the fact that you could have something and don't even know that you have it, because in my own family, I've never heard anything like about it.
What I would tell a family who is just diagnosed with Alport syndrome, one of the most important things, I think, and this is speaking from my personal experience, is to really just normalize Alport syndrome in their family. Talk about it, talk to your kids about it, especially if they're young, because they're having all of these experiences, but they probably don't understand what it's about. So just normalize it in your family, talk about it, be comfortable with it. I know that there are a lot of emotions that are associated with it, especially when it comes to, parents and their children. But it's okay. It's not the end of the world. It's not a death sentence, but make your kids comfortable with it. And I would also really encourage you to talk to other Alport syndrome families or other Alport patients, because it is so nice to be validated with our different experiences. It is so nice to be validated in the sense that we're not alone in this. And that is something that I wish I had found at a younger age. I wish I had found this community at a younger age, because especially being the only person in my family with Alports, I really felt alone in it. And I felt like nobody else understood me. So reach out to other people in the community, get involved in the foundation, and just really normalize it in your household. I was specifically reading the other patient stories on the ASF website, and I just really felt seen and heard, and I felt validated.
To me, it definitely helps to hear a lot of different stories because there are so many stories, and to not feel hopeless. Parents will probably, this is impossible, but to try not to worry, which I'm a big time worrier. Even before anybody was diagnosed with anything, I was a big time worrier. So trying not to worry and just to be hopeful, because there is so much hope, and it's not a sentence of being an unhealthy, miserable person for the rest of your life. So don't think that that's your children's life to come is just going to be terrible. Just every time I'd read or hear something new, I'd start to feel more, confident, more, hopeful about everything. So everything I read made me feel a little bit better. So, and I do with everything I've learned. I am telling the boys, please do not forget to take your medicine, because everything I've read, I've been telling them it is very important. They are definitely have studies that show that this is very helpful to prolong your kidney health.
There's a lot to be hopeful for in the future. We can't change our circumstances. We can't change what's happened to us or where we are in our lives. We can't change any decisions we've made in the past, but there's so much more to look forward to in our lives. And there's already been so many developments medically, just since, I received my, possible, probable, I'm not really even sure, kind of diagnosis late back in childhood. There's so many more things that can delay our progression, and really, even medications that may possibly treat it in the future. But even more so is the amount of people that care. Like, it's just unbelievable to me. And sure, a lot of us are patients or family members of others with Alport syndrome, but we don't just care, about ourselves or our family. We care about our larger extended Alport family. And there are people all over the world, all in the United States, that are willing and ready to, welcome you into this family and help you understand and help you process and help you just do whatever it is that we can to help you cope with this. So I think, more than anything, even more than the medications, the hope is that we have this family and we can help each other through it.
If I had to tell a family who was just diagnosed with Alport, the first thing I would want to tell them is that you're not alone. The one thing that definitely helped me is just doing some research, looking and see what's out there. Again, when I came across the YouTube video from the Alport Syndrome Foundation, it was great. And to know that I wasn't alone, because you hear that word rare, and rare scares you sometimes. But just know that it's rare, but you're still not alone. Definitely consult a physician, definitely consult your nephrologist, but just always be able to have, create a relationship with your team of doctors, so that, you can all be together, and don't ever just be afraid. Don't feel like, one question is a dumb question. No question is a dumb question, because again, this is your life. This is your family. And, you want to make sure that you're doing the right, making the right decisions concerning your family. The fact that you ask and sometimes you don't get the answer, or you don't get the story that you think, it makes you feel uncomfortable. So if you felt uncomfortable and you felt scared and you felt unsure, can you just imagine how your child would feel? Them not knowing what's going on. You talk around the issue to them, because it's like they're people too, and they know that something's going on. It's like my daughter, she knew that something was going on, and my daughter would ask me, and then we would sit down and talk. And today it helps her, because like this, we know that we have to prepare our children for the future and everything. In this, we need to prepare them too, educate them where they're at. You know what I mean? So it's like an 8-year-old you're taking this X, Y, and Z, but you got to keep educating. When they get to 11, this is the importance of it now. And then give them more history, give them more, okay, this is, if you take this pill, it's going to help you with this, and I think that helps.